Lymphedema is a occlusion or disruption of the circulation of lymphatic vessels. This can lead to, let's say, like similar to edema, let's say inflammation and infection of the usually extremities or of the affected area. Could be primary or secondary lymphedema. The primary lymphedema is congenital lymphedema. The classical example is in Turner syndrome or trisomy 21 Down syndrome. The secondary usually is after surgery. The most classical is post-mastectomy. The woman can develop lymphedema usually in the arm because the lymphatics that drain the arm have already been removed, and so the patient will have swallowing and sometimes could be a little bit painful. The treatment is with mobilization of the extremity. We don't want that the lymph stay there, so we need to mobilize that. Could be with massage or compression bandage or elevation of the extremity. Now the clinical presentation would be, if it is early, we see pitting edema. If it is late, we will not see pitting edema, non-pitting, and we will also see thick skin due to adipose tissue and collagen deposition in the subcutaneous tissue that leads to this. Now, there is a very specific sign that is called Summer sign. This is inability to elevate the skin of the second toe. So we're trying of the dorsum of the skin of the second toe. So this is the toe, and we are trying to elevate the skin like this, and we cannot. This is a very specific sign for lymphedema. So lymphedema is just a disruption of lymphatics, could be congenital or acquired. Other causes that are acquired is due to infection, usually filariasis that are, for example, for Bucheria bancrofti that produces elephantiasis, or could be lymphogranuloma venerum, for example, or gota. All these diseases produce secondary lymphedema, and especially the mastectomy, for example, or after surgery. The treatment is just mobilization of the extremity, and the presentation usually is late, but in early clinical presentation we would see pitting edema. And the idea of the pathophysiology is that the disruption leads to deposition of collagen and adipose tissue in the subcutaneous tissue. And the most important sign is Summer sign, that is inability to elevate the skin of the dorsum of the second toe.